Hey everyone, I'm Danny and welcome to Optimal MA. This is your go-to place for your CCMA exam prep. So if you're getting ready to take your Certified Clinical Medical Assistant exam, you're definitely in the right place. Today we're going to be reviewing some realistic practice questions to help you feel confident and fully prepared for test day. I'll not only go over the correct answers, but also explain the reasoning behind them so you can truly understand the concepts. We're going to be using quizzes for our review today. I'm trying something a little bit different. Definitely let me know in the comments if you guys like this or if you prefer a PowerPoint view. But let's go ahead and get started. All right, which dosage form can be absorbed slowly to create a constant time-release systemic effect? Is this going to be a liniment, transdermal patches, suppositories, or creams? Again, which dosage form can be absorbed slowly to create a constant time-release systemic effect? Liniments, transdermal patches, suppositories, or creams? I'll give you guys some time to think about it. Okay. So our answer for this is going to be transdermal patches. Now, transdermal patches are designed to release medication slowly over time through the skin and into our bloodstream. They provide a constant time-release systemic effect. This allows for continuous therapeutic levels of the drug without the need for frequent dosing. This is especially useful for medications that require steady blood concentrations. Some examples of transdermal patches will be pain medication, birth control, nausea medication. All right, next question. A medical assistant receives a call from a parent whose child has ingested a cleaning solution. Which action should the medical assistant take? Would you instruct the parent to contact the manufacturer, instruct the parent to call the poison control center, instruct the parent to induce vomiting, or instruct the parent to have the child drink 240 milliliters of water? What is the best logical answer for this? They've ingested a cleaning solution. What would you recommend? In this situation, you would want to contact the Poison Control Center. So in cases of poisoning or ingestion of toxic substances, the safest and most effective action is to immediately contact the Poison Control Center. Poison control professionals can provide guidance on the best steps to take specific to the substance ingested, and they may provide information on whether medical intervention is necessary. If you guys remember back in option C, it said instruct the parent to induce vomiting. We would not advise this. We would actually advise against this because depending upon the type of chemical that was ingested, it could actually do more harm than good. All right, guys, let's get to the next one. A medical assistant walks in to a patient's room and discovers a fire in the trash can. Which mnemonic device outlines the correct procedure? Would this be NKDA, RICE, PASS, or RACE? Again, a medical assistant walks into a patient's room and discovers a fire in the trash can. Which mnemonic device outlines the correct procedure? Time's almost up. Okay. If you said pass, you are correct. The pass mnemonic specifically describes the correct procedure for using a fire extinguisher. It is a critical step when addressing a small manageable fire, like one in a trash can. So the mnemonic pass means P for pull the pin, A for aim, S for squeeze, and S for sweep. And remember, when we're using a fire extinguisher to put out a fire, you always want to make sure that you're pointing it and spraying at the base of the fire. You want to put it out at its origin. Great job. Let's keep on going. All right, smoking is a risk factor for which of the following conditions? Would it be atherosclerosis, Graves' disease, pericarditis, or cervicitis? Again, smoking is a risk factor for which of the following conditions? Atherosclerosis, Graves, pericarditis, or cervicitis? Timer's almost up. 2 more seconds. This is going to be atherosclerosis. Now, this is basically the buildup of plaque in the arteries, and this can actually lead to heart disease, a stroke, and other vascular conditions. Smoking is a major risk factor for atherosclerosis because it damages the inner lining of the blood vessels. It also promotes plaque buildup and increases blood pressure, all of which contribute to the narrowing and the hardening of the arteries. Great job. Let's go ahead and get to our next question. How are you guys doing so far? Which of the following methods should a medical assistant use when weighing a patient who has balance issues? Would this be position a walker over the scale, have the patient hold on to the wall while weighing, position a cane on the scale between the patient's feet, or have the patient sit in a chair on the scale? Again, which of the following methods should a medical assistant use when weighing a patient who has balance issues? This is going to be to position a walker over the scale. Now, this provides stability and support for patients that do have balance issues. It allows them to safely stand and distribute their weight evenly without the risk of falling. By using a walker, the patient can actually grip a steady surface, helping to reduce swaying or instability that could affect both their safety and the accuracy of the weight measurement. This method is effective in clinical settings where chair scale may not always be available for our patients. All right, let's keep it up. Let's keep going. Next question. The medical assistant has obtained vital signs for an adult patient. The readings are as follows: a blood pressure of 110/70, a temperature of 38.3 degrees Celsius, a pulse rate of 106 beats per minute, and a respiratory rate of 22 breaths per minute. From the options below, which is the correct assessment? The blood pressure is elevated, the respiration is slightly increased, the patient is afebrile, and the heart rate is tachycardic. The blood pressure is stable, the respirations are slightly increased, the patient is afebrile, and the heart rate is tachycardic. The blood pressure is stable, the respirations are slightly increased, patient febrile, and the heart rate is tachycardic. Or blood pressure elevated, respiration slightly increased, patient febrile, and heart rate tachycardic. Out of these 4 options, what do we think is the most logic? The correct answer was actually C. A blood pressure of 110/70 is within normal range for adults. This does indicate a stable blood pressure. A respiratory rate of 22 breaths per minute is slightly above the typical range because remember, normal respirations are between 12 and 20 breaths per minute. And a temperature of 38.3 degrees Celsius is about 100.9 degrees Fahrenheit, and this is considered to be above the normal range. 100.9 degrees Fahrenheit does indicate that our patient has a fever. And then the pulse rate for the patient was high. Remember, the pulse rate said it was 106 beats per minute. Remember, our normal resting heart rate for an adult is 60 to 100 beats per minute. Anything greater than 100 beats per minute is considered to be tachycardic, right? That's their heart rate beating fast. Anything less than 60 beats per minute is considered to be bradycardia. Their heartbeat is slow. All right, next question. How many seconds does the CDC recommend for the proper hand washing? Okay, is it going to be 40 seconds, 20 seconds, 60 seconds, or 30 seconds? What is the proper amount of time to wash your hands? Got a couple more seconds left on this one. If you guys are wondering where the clock is, it's in the upper corner. This is what I'm looking at as we're going through the time. The proper hand washing time is actually 20 seconds, okay? So remember, CDC does stand for the Centers for Disease control and prevention, they recommend that we wash our hands with soap and water for at least 20 seconds. This effectively removes germs, bacteria, and also viruses, right? This includes scrubbing all areas from your palms to the back of your hands, between your fingers, and even under your nails. One of the common tips that we always tell people is to sing the happy birthday song. If you can sing that twice, you have effectively washed your hands for the allotted amount of time. All right, next question. Which of the following is used to drain fluid from a patient's body? Is it going to be an injection, a catheter, an intravenous drip, or a syringe? Which of the following is used to drain fluid from a patient's body? Again, injection, catheter, intravenous drip, or a syringe. Give a few more seconds. Timer's in the corner. Our answer for this is going to be a catheter, okay? Catheters are flexible tubes that are used to drain fluid from the body. They are used to drain urine from our bladder or excess fluid from the body cavities, like a chest tube. Catheters are commonly used for patients with urinary retention and post-surgical drainage, or even to remove excess fluid from certain medical conditions. Now, as medical assistants, it's not in your scope of practice to put in catheters, but we still have to know how they function and work. Let's keep it rolling. Next question. Which vein is located in the lateral antecubital space and is one of the two preferred veins for phlebotomy? Is this the brachial vein, the cephalic vein, the median cubital vein, or the basilic vein? Again, when we're looking at questions for the exam, we have to pay attention to the wording. They're asking which vein is located in the lateral antecubital space and is one of the two preferred veins for phlebotomy. Lateral. Now, for this is going to be the cephalic vein. Now remember, when we're performing phlebotomy, the median cubital is our go-to. It's our preferred vein. And if we don't have access to the median cubital, our secondary vein is going to be the cephalic. Now remember, the cephalic vein is actually located in the lateral antecubital space. This is the outer side of the forearm, okay? And it is one of the two preferred veins for phlebotomy because it's easy to access. All right. And again, remember, the median cubital vein is actually the most preferred vein, like I said a second ago, but it's not located laterally. It's in the middle. So that's why I said in the beginning, you have to pay attention to how the questions are phrased. When you're testing, especially if you're like taking NHA, they will try to trick you up based on the wording of the questions. So make sure that you are reading them thoroughly. All right, let's keep it rolling. Next question. What type of liquid should be used to fill an autoclave for sterilizing instruments? And I do want you guys to remember this. Is it going to be distilled water, hydrogen peroxide, boiled water, or is it tap water? Again, what type of liquid should be used to fill an autoclave for sterilizing instruments? And again, this is my first time using quizzes as a review like this. Definitely comment in the chat and let me know if you guys like this or if you prefer a different method. Now, the answer to this is going to be distilled water. There's no special chemical that's going inside of the autoclave. It's just regular distilled water. Okay. And the reason that we have to utilize distilled water is because it's free from minerals and impurities that could cause scaling, clogging, and even residue buildup inside of the machine. When we're using distilled water, it makes sure that the steam effectively generates. And remember, that is so important because it's the hot temperatures of that steam that is actually sterilizing our instruments. All right, let's keep it going. A medical assistant is speaking with a patient who has seasonal allergies. Which of the following healthcare providers is authorized to make a diagnosis and initiate treatment? Is it going to be a respiratory therapist, a physician's assistant, a registered nurse, or a pharmacist? Anemia, speaking with a patient who has seasonal allergies, which of the following healthcare providers is authorized to diagnose and initiate treatment? If you said a PA, which is a physician's assistant, you are 100% correct. You need to remember that PAs are licensed healthcare providers. They can examine patients, they can diagnose conditions, they can also prescribe treatments under the supervision of a physician. All right. Next question. A medical assistant is composing business correspondence using the simplified letter style. Which of the following features should the assistant include? Indented paragraphs in the body of the letter, the sender's name in all capital letters, a complimentary closing, or center-aligned dateline and salutation. We're talking about the simplified letter style. Out of these four options, which one should be included? All right, time's up. This is going to be making sure that the sender's name is typed in all capital letters, okay? We replaced the traditional closing statement like sincerely or best regards, okay? This format is designed to be more straightforward and efficient. It's often used in business or professional settings. So again, the answer for this one, we're talking about simplified letter styles, is going to be the sender's name. It will be in all capital letters. All right, next question. Which of the following terms refers to an abnormally low white blood cell count? Is this going to be leukemia, leukopenia, anemia, or leukoplakia? Abnormally low white blood cell counts. You guys have about 10 more seconds to think this one through. Abnormally low white blood cell count. The answer for this one is going to be leukopenia, okay? Leukopenia is a medical condition that's characterized by a low white blood cell count. And remember, low white blood cells are also referred to as WBCs or leukocytes, right? So since WBCs, aka leukocytes, help fight infections, leukopenia can make a person more susceptible to bacterial, viral, and fungal infections. It can be caused by bone marrow disorders, autoimmune diseases, infections, or certain medications like chemotherapy. All right, next question. 2 more seconds to prep. Here we go. A medical assistant is collecting a 24-hour urine specimen. Which of the following should the assistant document during the collection process? Would it be the temperature of the urine, ketones in the urine, the volume of the urine, or the pH level of the urine? You're collecting a 24-hour urine specimen. Which one of these should you document during the collection process? 5 more seconds to think it through. Now, the answer to this one is going to be the volume, okay? So during the 24-hour urine collection, the total volume of urine collected must be accurately recorded. The test measures substances in the urine over a full day. So documenting the volume ensures that we're getting those accurate test results. And it also helps assess any kidney functions, fluid balances, and waste excretion from the patient. Good job. And the reason that it wouldn't be option A, specifically if you guys can see it back here, the temperature, we utilize taking temperature on patients' urine specifically for drug screenings. Urine should always be within the same temperature as a patient's body temperature. So we're making sure that the urine is fresh and maybe not something that they've brought in from an outside source. All right, next question. In which of the following situations is a medical assistant required to wear sterile gloves? Would this be processing specimens, containing bodily fluids, performing a venipuncture to obtain blood culture samples, passing instruments to a provider during a cyst removal, or obtaining blood pressure from a patient who has intact skin. Again, so our key word here is going to be sterile gloves. Oop, highlighted the whole thing, sterile gloves, okay? It's not saying clean gloves, it's specifically saying sterile. And in this situation, you want to make sure that you're utilizing sterile gloves when you're passing instruments to a provider during a cyst removal. This is a little small outpatient procedure, and we have to use sterile gloves during this type of procedure because it's considered to be minor surgery. We use sterile gloves for minor surgeries, wound care, and also invasive procedures. We have to make sure that we're maintaining that aseptic technique by ensuring that no contaminants are introduced into that sterile field. We don't want our patient to get any type of microbes into their open wound. All right, next question. How are you guys feeling so far? Let me know in the chat. COPD is a disease state that refers to which condition? Is COPD asthma and atelectasis? Is it emphysema and chronic bronchitis? Is it shortness of breath and high blood pressure? Or is it asthma and chronic bronchitis? What is COPD? 5 more seconds. Give you a little bit of time to think about it. COPD is actually emphysema and chronic bronchitis. Emphysema and chronic bronchitis, remember, COPD stands for chronic obstructive pulmonary disease. And what this is, it's basically a progressive lung disease that includes 2 primary conditions. Again, this is going to be emphysema as well as chronic bronchitis. Now, with emphysema, it damages the alveoli, that's the air sacs, okay? And this makes it hard for oxygen to enter the bloodstream. With chronic bronchitis, this leads to inflammation and excessive mucus production in the bronchial tubes. And in turn, this actually causes persistent cough and breathing difficulties. Now, COPD is primarily caused by smoking and also if a patient has long-term exposure to lung irritants. All right, which of the following components of a business letter contain the conveyed message to the receiver? Is it copy notation, reference line, body of the letter, or is it the subject line? Which of the following components of a business letter contain the conveyed message to the receiver? Copy notation, reference line, the body of the letter, or the subject line? This is going to be the body of the letter, okay? The body of the letter. Now, the body of the letter, again, is the main section that contains the actual message being conveyed to the recipient. It includes the purpose of the communication, those important details, and any of that necessary actions or responses. The body itself is typically written in paragraph form, and it it follows professional formatting standards. All right, good job, you guys. Let's move on to our next question. When unloading an autoclave machine, a medical assistant notices spots on the instruments. The assistant should recognize that this is a result of what? Would it be improper cleaning of the chamber, mineral deposits from tap water, clogged chamber drain, or exposure to hard chemicals? This is when unloading an autoclave machine and MA notices spots on the instruments. Now, this is usually caused by mineral deposits from tap water, okay? Now, what happens with this is tap water contains minerals like calcium and magnesium, and they can actually leave a white or cloudy residue on instruments after they evaporate. So to prevent this, we only use distilled water in the autoclave. We're taking it back to the other question we had a few minutes ago. Only distilled water should be utilized inside of the machine. All right, y'all, next question. Here we go. A medical assistant is reviewing treatment options with a patient who has Graves' disease. Which of the following treatment should the assistant expect the patient to receive? Radiation to the thyroid gland, I couldn't even get the word out. Corticosteroid therapy, tongue-tied for a second there, growth hormone supplementation, or dietary supplementation. I have a stutter that you guys will see that pops through every now and then. But what is the correct answer? So again, when an MA is reviewing treatment options with a patient that does have Graves' disease, one of the treatments that you'll find for the patient to receive will be radiation to the thyroid gland. Okay. Now, the treatment works by destroying those overactive thyroid cells, and it reduces hormone production. Okay, so this is the purpose of this specific treatment. Couple seconds to our next question. A medical assistant is reinforcing instructions with a patient about how to take buccal tablets. Which of the following instructions should the assistant give to the patient? Do you place the tablet under your tongue? Do you swallow the tablet whole? Do you place the tablet between your cheek and gums? Or do you dissolve the tablet in water? Which one do you guys think is more logical for the buccal route of medication administration? Now, this is going to be to place the tablet between your cheek and gums. If we're looking at option A, where it says place the tablet under your tongue, this would be called sublingual. Under the tongue to dissolve is sublingual, but placing it between the cheek and the gums is what we call buccal. Okay. And with the buccal method, the medication dissolves here and it actually absorbs directly into the bloodstream through oral mucuses. The method actually does allow for rapid absorption while bypassing the patient's digestive system. All right, next question. Blood gases, EDTA tubes, other additive tubes, and serum tubes should be collected in what specific order? Is this protocol for blood pressure measurements, sequence for administering vaccinations, order of draw for microcapillary tubes, or steps for conducting a physical examination? So again, blood gases, EDTA tubes, other additive tubes, and serum tubes should be collected in which specific order? Now, when we're thinking about the order of draw, we're collecting the order of draw for those microcapillary tubes. Good job. And the reason that we specifically do this is because it prevents cross-contamination. Remember, each tube contains a different additive. And if we're not following that proper order of draw, we can cross-contaminate, which could actually compromise the specimen. Next question. How are we feeling so far, you guys? Don't forget to let me know. When scheduling a routine pap test and a HPV test for a 55-year-old patient, which of the following guidelines should the medical assistant follow? Is it going to be every 1 to 2 years, every 6 months to a year, every 3 to 5 years, or every 2 to 3 years? We're scheduling a pap test and a human papillomavirus test for a 55-year-old patient. What is the best amount of time? This is actually going to be 3 to 5 years. So now, according to the American College of Obstetricians and Gynecologists, women ages 30 to 65, a pap test with HPV testing should be done every 5 years, or a pap test alone every 3 years if the HPV is not included. And it just goes to show how much technology has changed and medical advancements. Because years ago, women were required to do PAPs every single year, but now they can have them extended out to every 3 to 5 years. Next question. There we go. Still getting used to quizzes. What does HMO stand for? Is it Health Maintenance Organization, Health Management Organization, Health Medication Operation, or none of the above? HMO stands for Health Maintenance Organization. And these are another one of those things that you guys need to remember for your certification exam, okay? With an HMO, you can choose a primary care doctor that coordinates all of your medical care. But I want you guys to remember with HMOs, this is the one insurance plan. They are a little bit cheaper than PPOs, but they do require a referral. So this means that you cannot just up and go see a specialist on your own. Say you want to see a podiatrist or an endocrinologist or a cardiologist. You cannot just schedule that appointment and see the physician. You'd have to see your primary care doctor first, and they would have to submit a referral to the specialist in order for the insurance to cover it. All right, next question. At what age is a patient eligible for traditional Medicare? 60, 63, 65, or 75? What age is a patient eligible for Medicare? The answer to this one is going to be 65. 65 for Medicare. All right, next question. A provider has ordered a hematology test for a patient. Which of the following tube colors should the medical assistant use? Lavender, gold, light blue, or red? Lavender, gold, light blue, or red? Hematology testing. This is actually going to be lavender. So the lavender tube is used for hematology testing like CBCs. And remember, CBC stands for a complete blood count. We also use the lavender tube for erythrocyte sedimentation rates. You guys may see this listed as ESRs. And we also use lavender tops for hemoglobin A1C testing when we're testing those diabetic patient sugar levels. Now, the lavender tube contains EDTA. Okay, this is an anticoagulant that prevents clotting and preserves the shape of blood cells for accurate analysis. So on your exam, you guys may see what type of additive is in the lavender tube. Remember, this is going to be EDTA. You guys may get asked a similar question. What type of tests are utilized with the lavender tube? Remember, hematology testing, CBC, and also the ESR and A1C testing. All right, next question. Oh, can't see it. A medical assistant, let's go this way. A medical assistant is completing a clinical intake and the patient reports experiencing fainting episodes. Which of the following would be the correct terminology for the assistant to document as a patient's chief complaint? Would it be bradycardia, syncope, sinus rhythm, or bradypnea? Again, the patient reports experiencing fainting episodes. What is the correct terminology for you to document as the patient's chief complaint? If you said syncope, you are 100% correct. Syncope is the term for fainting or temporary loss of consciousness due to a sudden drop in blood pressure and reduced blood flow to the brain. Common causes of syncope include dehydration, low blood sugar, heart conditions, and also vasovagal responses. All right, here we go for the next question. What is adipose tissue? Is it the sac around the heart, the fatty tissue in the body, the outer layer of the skin, or the inner lining of your diaphragm? Again, what is adipose tissue? If you said the fatty tissue in the body, then you are 100% correct, okay? Now, adipose tissue is a type of connective tissue. It's composed of fat cells, and it serves as several functions throughout our body. We utilize this for energy storage, insulin and temperature regulation, hormone secretion, and as a reminder that adipose tissue is found under the skin. And when we're referencing injections, if you are giving an injection, the sub-Q route, a subcutaneous injection, you're going into the third layer of the skin. You're going into the fatty layer. This is where that adipose tissue is located at. All right, next question. What is the act of chewing? Is this eructation, mastication, emesis, or deglution? What is the act of chewing? Eructation, mastication, emesis, or deglutition? The act of chewing. Now, if you said mastication, you are 100% correct. Now, mastication is the process of chewing food to break it down into smaller pieces. The process is essential for digestion because it mixes food with our saliva. And our saliva actually contains amylase. This is basically an enzyme that begins the carbohydrate digestion, and it facilitates swallowing. Great job, you guys. Great job, great job. Next question. Okay, a medical assistant is preparing a patient for wearing a Holter monitor. Which of the following instructions should the assistant include? You will be required to wear the monitor for 2 to 4 hours. You should avoid your regular exercise routine during monitoring. You should avoid using an electric blanket during monitoring. You can bathe and shower as usual during monitoring. What should we include? Now, if your response was you should avoid using an electronic blanket during monitoring, then you are 100% correct. The Holter monitor is an electronic device. We don't want the patient to use an electric blanket. We don't want them to get it wet. We don't want them to bathe. We don't want them to shower. We don't want them to go swimming. We want that machine to stay dry. And then remember, when it comes to Holter monitors, if the patient was only going to wear it for 2 to 4 hours, then it would be something that they can do as an outpatient procedure. But patients wear Holter monitors for a minimum of 24 hours. This is why they take them home. And where it says you should avoid regular exercise routines during monitoring, we want the exact opposite. We want to make sure that the patient is continuing to do all of their normal daily activities. The physician is going to want to see how their heart is reacting, doing their every day-to-day things that they do in their lives. If they normally take the flight of stairs, if they normally go up the flight of stairs to get to work, and when they wear the Holter monitor, they're like, you know what, I'm going to go ahead and take the elevator today. Well, we don't want them to do that. We want to see how their heart is functioning as they are going up those flight of stairs. Good job, you guys. All right, next question. I'm not sure about quizzes, but it's a new experience. What is a yeast infection of the mouth? Is this anthrax, thrush, rubella, or candidiasis? What is a yeast infection of the mouth? Anthrax, thrush, rubella, or candidiasis? If you said thrush, then you are 100% correct. So thrush is a yeast infection of the mouth. It's mostly common in infants. We'll see it as well in immunocompromised patients. And examples of immunocompromised patients would be ones that have cancer, HIV, and also AIDS. And then we'll also see this with patients who are on corticosteroids as well. Some of the symptoms of thrush will be a white creamy lesion on the tongue itself. We'll notice this on the inner cheeks and also in the throat. And patients may experience cracking or redness at the corners of their mouth as well. All right, next question. Prior to a patient's follow-up appointment, which of the following information should a medical assistant report to the provider? Would it be recent lab results, anthropometric measurements, the date of an upcoming mammogram appointment, or a change in the patient's insurance policy? Again, prior to a patient's follow-up appointment, which of the following information should an MA report to the provider? Now, if you said recent lab results, then you are absolutely correct. So lab results basically provide critical information about the patient's current health status. The provider will need the results to maybe adjust medications or adjust a treatment plan for a patient, even diagnose new conditions, or determine the effectiveness of ongoing treatments. Next question. A medical assistant is reviewing the lab results of a patient who has the Epstein-Barr virus. The assistant should identify that this microorganism can cause which of the following conditions? Would this be polio, mononucleosis, gastroenteritis, or Fifth's disease? Again, your patient has Epstein-Barr. The microorganism can cause which of the following conditions? Now, if you said mononucleosis, then you are 100% correct. Mononucleosis is also known as just being called mono, and it is caused by the Epstein-Barr virus as a member of the herpes virus family. Now, it spreads through saliva, and this is where it got its nickname, the kissing disease. It was easily spread through kissing, drinking, or eating after other people. Now, symptoms of mono include fatigue, sore throat, swollen lymph nodes, an enlarged spleen and liver, also fever and body aches. For this particular condition, there's actually no specific treatment, but management does include rest, making sure you're drinking plenty of fluids, and taking those fever-reducing medications. Next question. All right, which of the following is outside of a medical assistant's scope of practice? Is it performing clinical duties under the direct supervision of the provider, ordering additional lab tests to confirm a patient's condition, providing directions to a patient about preparation for a diagnostic test, or reinforcing instructions about medications and special diets? Which one is outside of the medical assistant's scope of practice? Now, if you said ordering additional laboratory tests to confirm the patient's condition, you are absolutely correct, because this now takes it into the term or into the realm of diagnosing, and it is out of a medical assistant's scope of practice to diagnose. Now, as medical assistants, you absolutely do perform clinical duties under the direct supervision of the provider. You'll be giving patients directions about preparation for testing, and you will be reinforcing instructions about medications and those special diets. Good job, you guys. All right, we have about, after this one, I want to say 10 more questions. Oh, yeah, 9 more after this. A medical assistant is caring for a patient who is terminally ill and has been crying uncontrollably, as well as refusing to eat or see their family. The assistant should identify this as which of the following Kubler-Ross stages of grief. Would this be considered depression, acceptance, denial, or anger? Ross has developed 5 stages of grief, and your patient is crying uncontrollably, and they are refusing to eat or see their family. What stage of grief would you consider this to be? If you said depression, you are absolutely correct. Depression is characterized by sadness, withdrawal, and feelings of hopelessness. With this scenario, the patient's uncontrollable crying, the refusal to eat, and also the avoidance are classic signs of grief-related depression. Now, when we're talking about the 5 stages of grief, this includes denial, anger, bargaining, depression, and acceptance. Good job, you guys. Next question. A medical assistant is performing an ear irrigation for an adult patient. Which of the following actions should the assistant take? Open the ear canal by pulling the pinna down and backward. Ask the patient to turn their head to the unaffected ear. Open the ear canal by pulling the pinna upward and backward, or aim the fluid towards the bottom of the ear canal. Which one is the more logical response? Now, if you said to open the ear canal by pulling the pinna up and back, then you are 100% correct. Now, in adults, the ear canal is more vertically oriented. So when we take the top of the ear, which we call the pinna, and we pull it up and then we pull it back, what it does is it actually straightens the ear canal, and this allows for better irrigation. Good job, you guys. A few more questions. In which of the following waste items should a medical assistant discard in a red biohazard waste bag? Which of the following waste items should be discarded in a red biohazard waste bag? Would it be used suture removal kits, syringe and needle used for venipuncture, linen soiled with bodily fluids, or broken ampules? Which one is the correct response? If you said linens soiled with bodily fluids, then you are correct. For a used suture removal kit, this is going to contain scissors, some tweezers. We are not going to throw this in a biohazard waste bag, okay? Anything that punctures into a patient's skin is considered a sharp, and sharps go into a sharps container. Those are those puncture-proof containers that you'll see in exam rooms and hospital rooms. We can never throw a syringe and a needle into an actual biohazard waste bag. It's got to go into that sharps container. Same with those broken ampules. Now, the red biohazard bags are designed for non-sharp biohazardous wastes that are contaminated with bodily fluid. Linens that are soaked or heavily soiled with bodily fluids must be disposed of in those red biohazard bags to prevent contamination as well as disease transmission. Next question. A medical assistant is preparing a patient who has anemia for an examination by the provider. Which of the following manifestations should the assistant expect? Irregular heartbeat, cloudy vision, itchy skin, or abdominal pain? Again, you're preparing a patient who has anemia for their examination. Would you expect them to have an irregular heartbeat, cloudy vision, itchy skin, or abdominal pain? If you said an irregular heartbeat, then you are correct. So anemia is a condition where there is a deficiency of red blood cells or hemoglobin that does lead to decreased oxygen delivery to the tissues. When oxygen levels are low, what happens is the heart works a lot harder to circulate blood, and this can result in an irregular heartbeat. Next one. A medical assistant is writing orders for an outpatient laparoscopic appendectomy. For this outpatient procedure, which of the following sets of procedural codes should the assistant use? ICD-10 PCS, CPT codes, HCPCS codes, or ICD-10 CM codes? Again, a medical assistant is writing orders for an outpatient laparoscopic appendectomy. For this outpatient procedure, which of the following sets of procedural codes should the assistant use? ICD-10 PCS, CPT, HCPCS, or ICD-10 CM? If you said CPT codes, then you are correct. Now, CPT codes stand for Current Procedural Terminology Codes, and these are used for reporting outpatient procedures and medical services. Those CPT codes are what we call the procedural codes. They are the codes that we are billing to the insurance company for the services that we performed, okay? So since a laparoscopic appendectomy is a surgical procedure performed in an outpatient basis, that code is going to be CPT, or procedural code. Good job, you guys. A medical assistant is drawing 5 blood collection tubes. When should the assistant release the tourniquet? Would it be after removing the needle, after a flash of blood is visible in the hub of the first tube, within 1 minute of application or between 2 and 3 minutes after application. When should the tourniquet be removed? If you said within 1 minute of the application, you are absolutely correct. So remember, we cannot leave a tourniquet on a patient longer than 60 seconds. And the reason for this being is we want to prevent complications like hemoconcentration, hemolysis, and also patient discomfort. If that tourniquet is left on too long, it can actually alter blood test results by increasing the concentration of cells and also protein in the patient's blood sample. The lab will call and say, hey, specimen's not good. We need another one. All right, next question. Which of the following procedures should a medical assistant perform on a soiled hemostat prior to autoclaving? Would it be antiseptic procedure, sanitization, disinfection, or sterilization? Again, which of the following procedures should an MA perform on a soiled hemostat prior to autoclaving? Antiseptic procedures, sanitizing, disinfecting, or sterilizing? Which one do you think? If you said sanitization, then you are 100% correct. Now, sanitizing is the number one. It is the first and essential step before sterilization. It involves the removal of visible debris and organic material like blood, tissue, and microorganisms from the instruments before they undergo further cleaning. All right, you guys, that was, let's see, this is officially the last question. A medical assistant is assisting a patient from a wheelchair to an examination table. Which of the following assistive devices should the assistant use to ensure patient safety when transferring? Would it be a walker, a cane, crutches, or a gait belt? Again, you are assisting a patient from a wheelchair to an examination table. Which of the following assistive devices should you use to ensure patient safety? Now, if you said gait belt, then you are 100% correct. So a gait belt is known as also being a transfer belt. Now, it is a secure assistive device that's used to help patients with mobility, impairment transfer safely from one position to another. Those gait belts provide a secure grip for the medical assistant to hold on to the patient without putting strain on the patient's arms, their shoulders, or their clothing. Now, gait belts do reduce the risk of falls and injury by offering stability and support during movement. So that's going to be the end of our review today. Great job working through these CCMA practice questions. This was my first time using quizzes as a review like this. Let me know in the comments if you guys did like it. I think I may stick with those PowerPoint slides for further reviews, or if you guys like this, do let me know. I do want to also start going live and inviting you guys to reviews like this where you guys can actually join in and participate. One thing I do want to say is just remember, the more that you practice and understand the concepts, the more confident you'll be on exam day. And I plan to come on here daily or every other day and start posting questions and giving you rationales behind why the answer is the way that it is. And also just going over some of those lessons that you guys need to know. If you did find this review helpful, if you guys don't mind, can you give this video a thumbs up and please subscribe, because there's a lot more to come to the channel. I know it's fairly new, but I'm looking forward to sharing some knowledge and insight with you guys on the clinical medical assistant material exam and just overall career. If you have any questions or if you need any clarification, please just go ahead and drop a comment below. I'd love to help. Thank you guys so much for watching, and I'll see you in the next video. Keep studying, keep pushing, and just know that you've